As recently as 8 April, ILO stated during a video conference organized by the organization that at the start of the year, before then COVID-19 spread worldwide, global unemployment already stood at around 190 million. ILO also stated that workers in 4 sectors, comprising up to 37.5% of the global employment figure, that have experienced the most drastic effects of the disease and falling production are food and accommodation, retail and wholesale, business services and administration, and manufacturing. Concerns were particularly expressed about the impact of COVID-19 on frontline health workers, who may be seen as less affected or less likely to lose their jobs in the current pandemic context. And currently, there are also some statistics that we also received from ILO, saying that in that context, the jobs of the healthcare workers, the frontline workers, are absolutely essential to overall world efforts to prevent, combat, and remedy against COVID-19. But are also, they are the most exposed to the pandemic in terms of health and medium to long-term health related risks of unemployment. I would like to go to our Africa region to focus more in the region I belong to. Although all regions of the world are suffering from the fallout of COVID-19, the Africa region, given its existing fragility of its economies and its employment market, is one of the worst impacted parts of the world, including with the high proportion of low-wage workers in informal employment, not only carrying higher risk of COVID-19 infection, but directly impacted by lockdown measures with limited access to health services, where an estimated tens of millions of informal workers have already been affected by COVID-19. ILO also correctly observed that COVID-19 has exposed the deep inequalities in the employment and labor market. Enterprises of all sizes have already stopped operations, including ours, cut working hours, and laid off staff. Often the first to lose their jobs are those whose employment was already precarious. Sales clerks, waiters, kitchen staff, baggage handlers and cleaners, because there is no flights, etc. In conclusion, the situation will not only increase the spread of the virus, but in the longer term, dramatically amplify cycles of poverty and inequalities. So if these measures are unsuccessful, healthcare systems in many countries will swiftly become overwhelmed, raising the risk of civil unrest. What is evident is that COVID-19 has impacted on employment worldwide. In the context of Africa's fragile economies, a most immediate impact is with people facing unemployment, and there are a number of COVID-19 mitigation or alleviation measures that can be taken by African governments without further delay, as part of the quick impact and immediate as well as medium and long-term actions. As the pandemic had an immediate impact in the health sector, the quick and short-term action was to reinforce healthcare to the population in getting medicine, increasing the technical capacity, and reorganize clinics, hospitals, improving the procurement system, etc. But this immediate response implies changes in the setting of priorities and the freeze of some budgeted but not immediately essential expenses in order to focus on and reinforce the offer of health services. However, this short-term reaction will not surface, and an assessment of needs and gaps should lead to a coordinated contingency plan, taking into account those with no social safety nets and the impact of the pandemic on unemployment for those losing their jobs, for example. For the latter, those losing their job, there should be the preparation and activation of financial and economic stimulus packages and other possibilities to alleviate sufferings of employees in lockdown, to cover their basic needs, temporarily paying their rents. In my own country, for this, and for the poor, the electricity bills, etc., and in order to reduce the burden on their shoulders. In general, then, the loss is used for those who are in informal daily wage activities, as it is the case for women and young people in Africa. Since these new needs were not budgeted, it has an impact on the macroeconomic framework, and the budget deficit will increase, as well as the commodity prices caused by the scarcity of goods. In the medium term, the pandemic represents an opportunity for governments to revise their fiscal policies in order to increase contributions from the wealthiest and to reconsider the health sector policy and guarantee access to health care for all and reduce inequalities, etc. We also need special measures to protect the millions of health and care workers, most of them women, who risk their own health every day to keep households and families afloat. Teleworking offers in modern sectors new opportunities for workers to keep working, and employers to continue their businesses through the crisis. However, workers must be able to negotiate these arrangements so that they retain balance with other responsibilities, such as caring for children, the sick, and the elderly, and of course themselves. It is also important that in order to ensure the adequacy of stimulus packages measures, national authorities and governments have to work in collaboration with formal employees through their trade union representatives to propose solutions, including on adoption of flexible working arrangements during the crisis, and to ensure health and safety and guarantees of job security or job security protection. Given the fragility and weaknesses of Africa's economies, this is easier said, I can confess, than done, but efforts have to be deployed. Most African governments depend on the support of international financial institutions and partners, namely the IMF, the World Bank, the United Nations, AFDB, etc. And in normal times, in order to design national economic and fiscal policies and support their economies' needs. Such support is going to be crucial in the current COVID-19 pandemic, which is weakening already Africa's fragile economies. Where I see that there are expressions of solidarity from rich countries, etc. I think this is the way to go and to support those who are already in need. Thank you. That poverty affects women and girls more in any social setting or national context, more so in Africa with its precarious economies and cultural norms centered around the power and influence of the male population. In short, women are the most discriminated against. They are most likely to be working in the informal economy. thus making them the most vulnerable among the poor population. It is also demonstrated by studies that when women in vulnerable settings get resources and opportunities, their first natural focus is on welfare of the family and children. And it is common to say that investing in women and girls means investing in the nation and in the people. There are experiences of financing institutions, funds, grants, or loans targeting women or putting smooth conditions for women entrepreneurs. Consequently, in the current COVID-19 context, there is a compounded economic impact on women and girls because they earn less, save less, hold insecure jobs, and live close to poverty. There is also a health impact on women and girls because national economic policies tend to favor unequal allocation of resources and priorities for the vulnerable, including services in sexual and reproductive health. Also, women and girls are disproportionately impacted by unpaid care work during times of COVID-19, with children out of school and under the home care of mostly women and mothers, with heightened care services needs being provided by women for all persons in the family, household in a situation of collapsing or overwhelmed national health services. Moreover, it's important also to highlight that there is a COVID-19 impact on related economic, social, and psychological stress owing to prolonged confinements in family, household settings, and isolation measures, which are leading to gender-based violence, forcing women and girls to be in mandatory confinement at home with actual or potential abusers, mostly male, at the same time that XVIV with victim support are becoming unavailable. That is a sexual gender-based violence. And mitigation measures could include, in my views, ensuring that women have equal representation in all COVID-19 national response planning and decision-making, like economic planning, emergency preparedness and response, voice to women's groups, field studies, and direct consultations. There is also the need for policies focused on driving actual change in favor of equality by addressing the informal and the care economy, both paid or unpaid, where women are most involved. These would include measures to ensure that formal economy, care jobs, women leaders in communities, teachers, nurses, and social workers are protected and empowered through deliberate policies targeting women and girls in efforts to address socio-economic impact of COVID-19. There must be a gender-focused design of economic and financial stimulus packages and social assistance programs favoring women and girls in order to achieve greater equality, opportunities, and social protection. Unfortunate perception has continued in the African context, where the agricultural sector, despite its role in food security, as well as economic growth and job creation, is considered unattractive and is associated with remaining poor and out of the modern system. In developing countries, particularly in Africa, we know that over 60% of the population is below the age of 25. This youth population will only continue to rise with the high trend of global population growth. The majority of these young people still live in rural areas where subsistence agriculture is prevalent. Combined with low national level policies investing in rural development and agriculture, in the context of urban migration, Africa's fragile economy stands an increased risk of collapse in the current context of COVID-19, which has paralyzed urban and general employment markets, thus creating an increasing force on unemployed African, mostly the youth, remaining mostly in urban areas with no incentive to return to rural areas at all. So we see more and more people who cannot live in the rural sector. Already in the pre-COVID-19 context, marked by an average unemployment rate of 40%, youth are disproportionately affected by not having formal or even informal jobs compared with the broader global population. At the same time, sustainable food and nutrition security in the world that will soon reach 9 billion people is a challenge, and more so as an immediate impact of COVID-19 affecting food production and supply chain. Without a doubt, job creation for youth in rural areas through the prioritization of agricultural production and food value chains is considered a crucial factor in current national policies. This is more so as agriculture employs more than 60% of the African workforce, and in sub-Saharan Africa, agriculture is more effective in reducing poverty than growth in non-agricultural sectors. Therefore, it is obvious that with its uncultivated arable land and its vast water resources in the world, policy makers in Africa should focus in developing the agricultural sector and should put in place national agricultural development structures without any further delay. In doing so, they will resolve key pressing problems, namely food insecurity, income generation, poverty alleviation, economic growth, and improvement of exports and trade balances. It is obvious that investing in agriculture in Africa contributes to maintain in active occupation the youth, the continent's main workforce, and thus avoiding the destabilizing demographic impact of urban migration and the negative economic impact also, this is important to underscore that, of the brain drain in Africa. All is about finally good leadership in Africa and the correct setting of priorities by the governments to ensure a massive investment in vocational training, technology, innovation, and access to land, finance, and changing the mindset through setting examples that work. In my country, Burkina Faso, for example, the government created a business startup funding program in place since 2017. And also a new bank for agriculture has been created since 2019. The first one, the startup 2017, and the bank in 2019, the agriculture focus on agriculture. The startup is innovative activities, initiatives from the youth, aiming at boosting rural entrepreneurship. However, this initiative is important to say that need to move fast with a massive investment for the long-term impact. This